I'm just going to be doing a presentation talking about this gynaecology pre-surgery school that I've been running for the past just over a year now. So the purpose of it is to obviously try and improve patient preparedness for gynecological surgery. What I'm going to go through today is talking a little bit about why preoperative education is important. What does the research say about it? And then talk a little bit more specifically about the actual project that I'm running here at Chelsea and Westminster, the impact and future projections for it as well. So just a little bit of kind of background, as I'm sure you're all aware, in endometriosis and, well, in general gynaecology services, but for me working in endometriosis service in particular, we know that there are delays in accessing care and that there are very long waiting lists for referrals, appointments and surgery itself. In our endometriosis service here at Chelsea, we noted that there were some last minute or on the day cancellations of surgeries due to patients waiting really long lengths of time from their actual clinic appointment until the surgery date. And by the time they actually get to their surgery, they had a lot of questions, didn't necessarily feel prepared, and that was causing some kind of late notice cancellations. At other times, patients get a date for surgery actually quite quickly after they're seen in clinic. This is often because the sort of clock starts ticking as soon as the referral comes in. So if the discussion around surgery has already kind of been had, and then we see you in clinic, and that waiting time for the initial appointment is long, sometimes a surgery date can be offered more quickly, and that can feel really overwhelming for patients that it's happening so quickly and they're not feeling ready. So these patients, they often require kind of ad hoc contact with the specialist nurses prior to their surgery, and this can be challenging to manage amongst the other clinical responsibilities, and to make sure that these patients are having, adequate time to talk about everything that comes along with a surgery like this. So what's the situation? So evidence shows that patients who are well prepared for surgery have a much better surgical journey overall, with less complications and shorter lengths of stay. The process of prehabilitation uses interventions such as lifestyle modifications, including smoking cessation, alcohol reduction, increased exercise, to positively influence a patient's fitness for surgery. The pre-operative period is ideally situated to initiate these interventions, as patients are often more likely to be motivated while awaiting surgery, more empowered to be active participants in their surgical pathway through increased awareness of anaesthetic pain relief options, and also information about kind of post-operative recovery, including physiotherapy, mental health support, and that can really help to with the preparedness for patients. So just some evidence here, a study in 2025 by Kamal Mitchell. The highlight from this being that they did a review of more than 38,000 surveys of patients pre-surgery. They found that 48% of patients are anxious before their surgery, which lowers the patient satisfaction with the service. And patient satisfaction is directly associated with a range of good health outcomes. And patient education can reduce preoperative anxiety and increase satisfaction. And this study found specifically that educating these patients pre-op increased the satisfaction level. So the pre-op education in this study was looking at what to expect from the surgery itself, and particularly when to seek help. So further, some benefits of pre-operative education. So these kind of projects have been done in other hospitals, and a lot of their outcomes have shown the following. So reduced anxiety and increased satisfaction, as I've mentioned there, in the service. So psychological preparation through education can lower patient stress and improve their overall satisfaction with the surgical experience. Improved post-operative outcomes. So preoperative information can lead to better management of post-operative pain, improved recovery, and potentially shorter hospital stays as well. And the enhanced patient preparedness. So patients who are well informed are more prepared for the surgical experience, which is associated with better outcomes and quality of life after the surgery as well. So what was the aspiration of doing this project? The Gynae School aims to deliver a high quality, patient-centered information service to promote active preparation psychologically and physiologically before surgery. wanted to provide a dedicated time for patients to attend a session prior to surgery, to answer their questions, reduce anxiety, provide support as well as the education, and to improve their preparedness for surgery. So reducing those on-the-day cancellations that I mentioned and improving that patient experience and their post-operative outcomes as well. So the solution being the face-to-face session that I hold once a month here at Chelsea and Westminster. Each session lasts around 60 to 90 minutes. The benefits of it being a face-to-face session means that these are actually really engaging sessions for patients, interactive, have really easeful communication, and an opportunity as well to gain peer support from other patients in similar situations. Particularly kind of for me as an endometriosis specialist nurse, I get quite a lot of my patients come along, and there's been some really lovely discussions we've had before in supporting each other around endometriosis and surgery in particular. However, we are working towards providing a virtual and a recorded session to enable a lower cost option to patients and for the trust as well, as patients don't have to travel, and it really improves accessibility for more patients to attend. So obviously this is something I have to do during working hours during the week, so it's not ideal for everybody to be able to attend. The videos as well will be available in different languages and will be captioned, and the online option, so to kind of add a Teams element to it as well, means that a lot more people can attend from home. And this is really important to think about with these kind of surgeries, as people are often having quite debilitating symptoms and aren't always able to come into hospital. With the recorded sessions as well, so these will be getting underway very soon. This means that the patient group can re-watch the videos as many times as they want to, which will hopefully help with that continuation of information that they have before surgery, and they can review it afterwards as well, just to have that information accessible to them whenever they want to. So that will be uploaded to our intranet. The session is provided for patients having any form of gynecological surgery. So we discuss a wide variety of different gynecological surgeries, and we provide written information as well about each of those different procedures that they may be undergoing, so they can go away with some written information as well. Patients are able to book themselves in currently via the endometriosis and fibroid email services. They are otherwise booked in by the scheduling team when they're being booked for their procedure, or by the clinician actually listing them for surgery when they're in clinic. The patients currently, they can be booked in via a register system. During the actual session itself, they're booked in by register system. All patients are asked to maintain confidentiality during questions, asking only generic questions, with any kind of personal questions about their specific case responded to after the session. I'm happy to do kind of face-to-face catch-ups afterwards, or book in a telephone conversation if they need kind of further information. Questionnaire is then completed at the end of the session for them to provide us feedback, and there's also an online feedback as well, which is all anonymous, and just helps us to gather some information about the response to the sessions. Hopefully keep them going. So a little bit of the session structure. So I'm going to take you through just briefly kind of the slides in a moment, but we go through prehabilitation, so preparing in the weeks to months before your surgery and how you can optimize yourself, and what to actually expect on coming into hospital, what will happen during the admission, waking up and going home. We talk about recovery tips, pain management, what to expect pain-wise, and what we recommend analgesia-wise, pain relief-wise. Post-op exercises that are really important, and also advice for recovery and signposting of where to go if anything is concerning post-operatively. And all of this information is given written as well, either from the ward with the wound care advice and contact information, and then the rest of the information is given on a written leaflet. So this is just to show you a little bit obviously can't see all that well, but I just wanted to show you a little overview of what we go through actually in the session. So as I say, a bit of prehab. So we talk about diet and how important that is for promoting good wound healing, reducing pain, and reducing constipation, which can complicate things post-operatively. So that's important to talk about. We talk about exercise as well. So thinking about a 6-week prehab kind of exercise program. So that's whatever the patient can manage. So whether that's, I mean, the ideal, you say at least 40 minutes of some form of exercise, whether that's walking, and 40 minutes 3 times a week in the at least 6 weeks pre-op. That 6-week window, there's quite a lot of research on that really improving outcomes for patients. So we talk about that. If, you know, because of issues such as endometriosis, if they're having really severe symptoms before their surgery, anything exercise-wise is beneficial. So whether that's stretching at home, just going for gentle walks, that will still provide benefit. We talk about smoking cessation, and we can signpost patients to where they can get support with that. How to prepare actually for coming into hospital. So doing your chores at home, changing your bed linen, getting a big shop in, getting some nice healthy meals in the freezer, really important. What to bring in with you when you come into hospital. So the clothes that you want to be wearing on your way home. So nice loose fitting clothes around the incision sites. Things like sanitary towels and things that were going to keep you comfortable and support you while you're in hospital. So obviously leaving valuables at home, removing jewelry, all of that sort of thing. And then we talk about what to actually expect. So where they're going to be going when they come to the hospital, what they'll be asked to do. So the TED stockings, the compression stockings to reduce the chance of blood clots, the surgical gown, what the nurses will do, checking your observations, everything like that. We have pictures here included as well of what actually the areas look like, so the patient knows a little bit about what things are going to look like when they get into hospital. Talk about recovery, so obviously going into being put to sleep, and then when you wake up and you come into recovery. Visiting guidelines, and then we talk about when you wake up, what might be what you might find, so attachments that you might wake up with. So we talk about a catheter, and then I show the patients what a catheter looks like, how it works. Similarly, IV drip, so have one of those with me and show that to the group. We talk about possibility of having a drain. So again, this is all very dependent on what kind of surgery you'll be having. Patient-controlled analgesia. So this is a continuous pain relief that can be used after specific surgeries that's activated by a button. Vaginal packs, and then we talk about post-surgery observations. So informing people, you know, you're going to be checked regularly by the nurses, and that this is often during the night as well if you have to stay. So just to pre-warn people that they will be checked regularly and what the process of that will be like. And then we talk about recovery. So what it will be like in those kind of first hours while still with us in hospital. We talk about things to do following on from the first day of your operation. So things like leg exercises, so to reduce those chances of blood clots, so pointing, flexing the feet, doing deep breathing exercises. So this is really important to reduce the chance of getting a chest infection post-op. And these things can help as well with pain management and just getting the body moving again. We talk about what to expect pain-wise, depending on the surgery, and what we recommend for pain relief. We talk about expectations of going home. So especially talking about how each person is different. It really depends on what kind of surgery you're having, and just being aware of the possibilities. And then getting home. So talking about obviously very much the importance of rest, as well as balancing that with trying to have regular movement, particularly for importance of the bowel. So we talk specifically about the bowel, importance of staying hydrated, dietary things, how to optimize things like chewing gum after the surgery can help to stimulate the bowel more quickly. And the mobilization, as I say, is really important for getting the bowel to move. Lifting the feet on when you're using the toilet can also help as well. Talk about wound care, so specifically depending on which kind of surgery you're having, and then kind of ongoing management. And again, this is dependent on surgery, but lifting restrictions, how to kind of modify how you do things in those first few weeks after surgery, with things like shopping, so not doing so really heavy lifting and things like that. Again, chores at home, cooking, cleaning, all of that, and getting back to work, driving, sexual intercourse, obviously all dependent on the surgery. The following slides are about all of our contact information and everything like that, which I haven't included here, but so that the patients have all of that available to them. So that's a bit of a rundown of what the actual session looks like. And then just a little overview of the impacts that we've seen so far. So as I say, this has been going on for just over a year now. We've had 22 patients attend, and they've all provided feedback. So 100% felt that the information given was the correct quantity. 95% felt that their questions were answered in a way that they could understand. 100% of them would recommend the group to others, which I feel is fantastic. And more than 85% scored 10 out of 10 for helpfulness of the information given. And then just to go through those kind of figures here, and then just to have a little review of some of the comments. So I just wanted to highlight this one comment from a patient saying this was a very helpful and reassuring session ahead of surgery. This session makes such a difference in feeling prepared and supported ahead of surgery. It helps to get to know the team, the hospital, and know the nurses and team are there to help me. Such a brilliant opportunity to not feel alone. Endometriosis is such an isolating illness, and this really helps. So that was quite a nice one. And as I mentioned earlier, those sessions where I have quite a lot of endometriosis patients there, we end up having a bit of a support group as well, which I always love. And yeah, we've had some really great feedback, particularly from those saying had laparoscopies previously in other countries, other hospitals, and not received any information, and that this has been really helpful and changed their experience of having surgery. So that's really brilliant. So a bit of a evaluation. So there's an audit underway with looking at any reduction in analgesia use. So that's while the patient is on the ward, and then looking in their first couple of weeks of recovery as well. The length of hospital stay, reported pain levels, any readmission rates, and the patient experience of recovery as well. So this, the patient will be compared with a patient that's having the same surgery roughly around the same time, and with similar demographics as possible. So this is a retrospective audit, and we are hoping to present at a future BSGE conference once hopefully published. Early findings are showing there is definitely improved patient satisfaction and reduced analgesia use and readmission rates as well. So there will be a questionnaire of the patient experience to get some of that qualitative data following the session, and following the surgery then to assess their experience, in particular interest in those that have had previous laparoscopies, to compare to, with an experience where they didn't have this kind of preoperative information, and how they compare that experience with having had that pre-op information. So the scope for the project, as I did mention briefly earlier about the online and pre-recorded option for this. So that is underway and should be the recorded sessions by summer 2026 is the aim, and then online, hoping to start from the end of this month to offer patients an online option. We want to recruit patients who are seen in clinic when they're being discussed being listed for surgery. Preoperative assessment clinics, I'd like to get it out there to make sure that all of these different points where the patient is seen, they can be booked in, and when they're actually being booked by the booking team, to be invited to attend as well. And as I said, by that pre-recording of the sessions and uploading, there's potential for a much larger cohort of patients that can access this information and really benefit from the programme. And again, as I said, they can access this information as many times as they want, whenever they want. So that will hopefully really improve care for lots and lots of patients. So the key learning points here, so we want to really promote this service to all surgical specialties as well. So obviously this is gynaecology, but promotion of this kind of project is really crucial in order to establish a functional referral pathway. I aim to have patients referred as soon as possible in their surgical journey. So making sure that when we're having any conversations about surgery, gynecological surgery, they can be offered this session. And the benefits of prehabilitation are, as I said, best actioned at least 6 weeks pre-op. There is some evidence as well that suggests that patients who attend these kind of sessions that actually don't go on to have any surgery report that the lifestyle changes are still beneficial for their health and for their pain. So it's a win-win all round. And to consider all stakeholders in the pathway, so increase the chances of the patient to be referred. So all specialist nurses that patients might come across, administration teams, surgical booking coordinators, surgeons themselves, and the pre-assessment specialist nurses as well. So we want to get the word out there. So summary and key takeaways. Prehabilitation, we have seen in previous research improves surgical outcomes, and hopefully I can evidence this with the published audit. Patient education reduces anxiety and increases satisfaction in the service. Early referral and engagement are really crucial for this project, and that virtual options are planned to expand access and availability for patients. So thank you so much for listening, everybody. I've just included some resources here for patients. Obviously popped a little bit about endometriosis and surgery, and then the POGP and RCOG are fantastic resources for patients to access information about all kinds of gynecological surgeries. So I'm happy to forward that on if need be. And just, some more specific about endometriosis if that's of interest to anybody. So I will go to some questions.